Question 22.
What does a valid CPT code look like? Describe what it looks like, don't just give an example. A CPT code will always be 5 numbers. What does a valid HCPCS Level 2 code look like? It is a letter followed by 4 numbers.
Question 24.
What does a valid CPT modifier look like? It is 2 numbers. What does a valid HCPCS Level 2 modifier look like? It is 2 alphanumeric characters. It could be 2 letters or a letter and a number. Use Appendix B of the CPT for annual additions, deletions, and changes.
Question 27.
What is a modifier's purpose? Modifiers affect the meaning of a CPT code or a HCPCS Level 2 code. They clarify and add additional details to the procedure code's original description so you can completely and accurately report the service that was actually provided to the patient at the encounter. So at its simplest, they are used to clarify and add additional details.
Question 28.
True or false? The inside front cover of your CPT has a list of modifiers. You may select your modifier directly from this page. The answer is no. It's false. Use the inside front cover as an index. Confirm the actual modifier selection by reading the full description of the modifier in Appendix A of the CPT.
Question 29.
Does place of service matter when selecting CPT modifiers? Yes. Look at the inside front cover of the CPT to see examples of this.
Question 30.
Use Appendix A for CPT modifiers.
Question 31.
Where can you find the most commonly used HCPCS Level 2 modifiers without going to the internet or the HCPCS Level 2 manual itself? The inside front cover of the CPT has the list of the most commonly used HCPCS Level 2 modifiers.
Question 32.
What is an inpatient? It is a person who has been formally admitted to a hospital under a doctor's order with the expectation the patient will be there for 24 or more hours.
Question 33.
If a person has not been admitted, is the person an in or outpatient? If they have not been admitted, they are an outpatient.
Question 34.
A patient has been admitted to observation. Are they an in or outpatient? Don't let that word admit fool you. If they were admitted to observation, they are an outpatient. A physician goes to a skilled nursing facility to see a patient. Is the person an inpatient or outpatient? Skilled nursing facilities, the patient is an inpatient. Skilled nursing facilities have 24-hour medical care like a traditional hospital.
Question 36.
What is the universal claim form outpatient? CMS 1500. What blocks are used for procedures? Block 24. The minimum number of codes is 1. The maximum number of procedure codes is 6.
Question 39.
The purpose of Block 24, Column E, Diagnosis Pointer, on the claim form, it is for medical necessity.
Question 40.
What are the only valid entries in Block 24, Column E? These are the letters A through L. These 12 letters correspond to the Block 21 12 slots for diagnoses. What is the minimum and maximum number of modifiers you may put on a claim form? The minimum is 0. The maximum is 4. What is the difference between new and established patients? A new patient has not received any professional services from that physician or from another physician of the same specialty of the same group practice within the past 3 years. So don't forget that part of the same group practice. It looks like there's 3 things, but there's actually 4 things. Not received any professional services from that physician, physician same specialty, same group practice, 3 years. Established patients have received professional services from that physician or from another physician of the same specialty of the same group practice within the past 3 years. See your CPT E&M guidelines for a decision tree or chart that can help make this more clear. Why does it matter if someone is a new or established patient? The status of new or established is going to impact your code selection. There are some codes for new patients, there are some codes for established patients, and you get paid more for new patients.
44.
What does a Medicare patient need to sign if a non-covered charge is proposed? Advance Beneficiary Notice, ABN. From the clinical point of view, what happens if the Medicare patient declines to sign the form? Well, then your practice is not going to provide that service.
46.
From the administrative point of view, what happens if the Medicare patient declines to sign the form? Staff needs to document in the files that this happened, that the patient refused the service.